Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about Rivaroxaban, which is a new molecule with potential to balance bleeding risks as well as ischemic events in patients with chronic coronary syndrome. Now, globally, the prevalence of chronic coronary syndrome, we all know that it increases with age. In India specifically, there is a rapidly growing burden of coronary artery disease, which has become the leading cause of morbidity and mortality. Now, the Journal of Associations of Physicians of India reports a review article about Rivaroxaban, which is a new drug that is found to be effective in managing bleeding risks as well as ischemic events in chronic coronary syndrome patients. Now, despite recommended medical therapy, the patients with chronic coronary syndrome are still at risk of ischemic events. Currently, the dual antiplatelet therapy is recommended in the form of aspirin as well as low-dose Rivaroxaban in patients with stable coronary artery disease or even peripheral artery disease. So, Rivaroxaban has shown a low risk of drug-to-drug interactions, and it usually does not require regular monitoring for coagulation if given at fixed doses, owing to its predictable pharmacokinetics and pharmacodynamic properties. So, when the tablet is orally taken, it is quickly absorbed and the maximum plasma concentration is achieved within 2 to 4 hours. Also, a low dose of Rivaroxaban in combination with aspirin is a promising approach. However, for patients who might benefit the most, it still remains a challenge. Now, clinical trial data on this new drug was certainly very encouraging, with evidence that was taken out from the COMPASS trial, which we previously discussed in our one-off videos. So, to review it, the subgroups of COMPASS trial did suggest that the addition of Rivaroxaban to aspirin was associated with a significantly lower risk of ischemic events, mortality, and even tolerable bleeding profile in patients with chronic coronary syndrome and high-risk factors. Thus, this combination is definitely found to be cost-effective and generally well tolerated in patients with coronary artery disease or even peripheral artery disease, as well as patients with chronic coronary syndrome and multi-morbidity or high-risk populations. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.